Hi, my name is Ann Alton. I am one of the staff physical therapists at Kirk Center for Healthy Living. Today I'm going to come and talk to you a little bit about the vagus nerve. We're going to do a whole series on this. Um, but basically, what is the vagus nerve? It's one of my favorites. It sounds funny, but it comes directly from the brain and bypasses your spinal cord, and it goes straight to all of your organs. Basically, its job is to regulate those organs when we're in the rest and digest. And the opposite of that is our fight or flight or even freeze. Okay, so when we're in the calm, nice, lovely, relaxed, connected state, that's when the vagus nerve is the most active. And so we want to take care of that. We want to make sure that that's working correctly. So dysregulation looks like irritability. It looks like all kinds of moodiness and poor decision making. It can slow digestion, increase your blood pressure. It can increase pain. Okay, so there's lots of reasons to regulate this nerve. We can have a healthier immune system, decrease inflammation, regulate our hormones, have less pain, be better able to tolerate stress and pain, have better relationships, better decisions, and have better sleep. So, without much further ado, we're going to do a couple of exercises, and note that some of these exercises can possibly trigger kind of more of the upregulated, more irritable state. Okay, if that happens, just stop, relax. Go ahead and watch the rest of the video, but because we're going to do a grounding exercise afterwards that should help bring you back to normal. But in the meantime, if you find that you're upregulating, if you're starting to become more irritable, just stop and relax. Quit following along, and we'll go from there. We'll do several of these exercises over the next few months. Okay. The first one that I wanted to teach you is eye movements. Okay, and I'm just going to go through just part of it. Okay, and then you can practice the rest on your own. All right. Sorry about that. I forgot to turn off my notifications. Anyway, so the eye movements, I have to use my fingers. You may not have to. But I have to use my fingers. I have to look and watch my fingers slowly track off to the side. And you're going to go as far as you can until you feel a stretch in your eyeball muscles. Okay. And that stretch may not feel the greatest. It may feel a little achy. That's okay. And basically, you're going to hold this until you feel something happen, kind of a switch. And there was one of mine. Okay, so you're looking for a deep breath. You're looking for a swallow, a yawn, kind of a melting feeling, anything that indicates that you're starting to relax. Okay. After that happens, you're still over here. You're going to track all the way very, very slowly off to the other side. Wait, same thing is going to happen. You can do up and down, and then it's up to you after that. If you have the time, if you are still in bed waiting for sleep, you can practice the 1,000-yard stare, which is basically trying to find the middle, trying to find where both your inner and outer eye muscles are equal, the upper and lower eye muscles are equal. And so what happens with that is that it's like you're looking out towards the horizon, okay? You can either do that eyes open, eyes closed. You can do that previous exercise, eyes open, eyes closed. You can also do what we call cupping, which is to put your hands over your eyes, keep them open this time, and act as though you are looking out at the horizon of a wheat field or the ocean, whichever makes you feel happier. The reason why this works is because when we're in fight or flight, our eyes are going like crazy, okay? They're going everywhere, but they're not using the periphery. They're just using the center of your vision, your visual field, okay? And so what this does is bodily, it speaks your survival brain language. Bodily tells your your brain that, hey, our eyes are moving slowly and we're using the periphery. So we must not be in trouble. We must be okay. So we can relax. So that's one of them. The second one I am not going to demonstrate for you because it was bound to increase your irritability, and that is singing or humming. Okay, you can do this in your car on the way to work. You can do it, in the shower or anywhere. But basically, why that helps is because the vagus nerve comes down and it has a great relationship with your vocal cords. And so, what you're doing is you are stimulating that, which is going to help stimulate the rest of the vagus nerve and increase your digestion and all of the organs that we talked about earlier. Okay. So, if you are feeling a little bit irritated, you're irritable, that could be because of me, or it could be because of the exercise that we just did. And so, we're going to do a quick grounding exercise. And the best way to do that is the reason I have the chair behind me, okay? And the chair here, we're going to go ahead and sit in the chair. And you're going to find just a little bit, you're going to find your contact points. So your contact points are going to be where your butt, your sit bone hits the chair along with your thighs, where your feet hit the ground, could be where your back hits the chair, and where your hands hit your thighs, okay? And if you need a little bit more stimulation, you can move your feet, you can kind of wiggle your buns, rub your hands, okay? But I want you to scan those three areas, and I want you to find the area that feels the most prominent to you, and concentrate on that, okay? Your thoughts are gonna wander. It's what they do. Your heart breathes, your lungs breathe, your heart beats, your stomach and intestines digest, your brain thinks. It's what it does. So no worries, no shame, no blame, okay? Just notice that it happened and bring it back to those contact points. And what that's going to do is again, speak your survival brain's language and bring it back to, hey, I'm here, I'm now, and I'm safe. Okay? And so that's it for number one of the vagus nerve, and I hope you stay tuned for the next ones. Hope you have a great day. Thanks for listening.